Okay, I guess we can get started. Hi, everybody. I'm Caleigh. I'm a Doctor of Occupational Therapy student at the University of the Sciences. So today I will be presenting on Goodwill Home Medical, along with some information about the University of the Sciences and my capstone project that I'm completing at Goodwill Home Medical. And with me, I have the Vice President, Lynn Tighe.
Yes, good morning, everyone. Thank you so much for joining us. We're very excited to have this opportunity to work in collaboration with the University of Sciences. And Caleigh's doing a great job on her capstone project, and she'll share that with everybody. And we continue to work with them. We have occupational therapy students coming into our site. Actually, they were just there yesterday to do their labs. So it's a wonderful hands-on opportunity for occupational therapists in training to actually touch and feel the equipment that they're using. But thank you. Any questions, just put in the chat and we will answer them later. And at the end of her session, we'll answer all your questions. So thank you very much.
Thank you. Okay, so to begin, first, I'm going to just give some information about Goodwill Home Medical. So the mission of Goodwill Home Medical is to provide gently used, sanitized, and refurbished durable medical equipment and medical supplies to individuals in need at affordable prices without a prescription from a physician, and insurance is also not accepted. On this slide, we have two pictures of customers with the medical equipment that was purchased from Goodwill. The access to affordable medical equipment allows an individual to be more independent and safe with their activities of daily living. This increased independence can further enhance their quality of their daily life. Goodwill Home Medical equipment is accredited by CHAP, which is a Community Health Accreditations Partners. CHAP is a Medicare-approved accreditation body. All sanitization and refurbished medical equipment is completed in accordance with CHAP standards of excellence for resale. So this is a picture of the 16,000 square foot warehouse. The warehouse is located at 300 Benigno Boulevard in Belmar, New Jersey. It is a division of the Goodwill Industries of Southern New Jersey and Philadelphia. The medical division sells sanitized, refurbished, gently used, donated medical equipment and unopened medical supplies. The warehouse serves as the central processing center and also functions as a retail outlet with a showroom and an administrative office. As you can see in this picture, there's a lot of medical equipment such as wheelchairs, shower chairs, electric scooters, pediatric equipment, and many more items. When customers come into the warehouse, they're able to look around on their own at the equipment to explore, but we also have knowledgeable staff to assist them in locating the equipment or the supplies that they need. So moving on to talk about who we serve. Goodwill Home Medical equipment serves patients, caregivers, doctors, nurses, rehabilitation specialists, physical, occupational, speech therapists, social workers, home health aides, hospice nurses, and others who are in the market for purchasing or donating home medical equipment or parts. New customers are coming in daily who are experiencing new life experiences requiring them to purchase DME or donate DME, possibly for themselves, a family member, or a client. We have accounts receivable with different healthcare and rehab facilities. Recently, an AR healthcare facility in Southern New Jersey bought 100 pairs of crutches from us due to the supply chain issues that are currently happening. These crutches were then distributed to other facilities so that they could be given to the patients in need. We work with the New Jersey Office of the Attorney General, the Division of Consumer Affairs, by providing home care companies seeking accreditation with the access to items and equipment that is required for their skills lab. We also work with the medical missions in Peru, which I'll explain in a little bit more detail. So our referral base mainly consists of physical therapists, occupational therapists, discharge planners, home care, home health aides, and nurses. This is a picture of the medical equipment that was donated, and it's in the truck in Peru. The representative from the medical missions comes about twice a year to the warehouse. Because of COVID, things are now able to start to pick back up again. The rep will actually FaceTime the therapist in Peru when she comes to pick out the equipment. This way, the therapist in Peru is able to see what is available at the warehouse and align that with what would best fit the needs of the clients in Peru. The mission ships about 30 to 40 pieces of equipment each visit, and the rep has been here about 3 to 4 times. These shipments go to individuals in Peru who don't have access to the medical equipment they need. This equipment can range from pediatric to adults, and some of the equipment is purchased and some of it is donated. So here we have a picture of the Philadelphia Inquirer. They came to the warehouse to gather information to publish an article about Goodwill Home Medical Equipment. And we have a picture of our team lead, Myra Morales, assisting a customer in finding a Hoyer lift for his mother. Myra is bilingual as well. She often assists Spanish-speaking customers when they are looking for different medical equipment to purchase or medical supplies. And we also have 3 other employees on the team who are bilingual. So this is a picture of, and a brief synopsis of how our donation process works. Donations are accepted at all of the Goodwill locations in New Jersey and Philadelphia, and we are sustainable through receiving these donations. Some of the donations that we accept are gently used wheelchairs, walkers, canes, hospital beds, and we have a full list, extensive list of items that are accepted on our website. So when the donations are first received, the initial triage assessment occurs. These items are thoroughly and visually inspected and then sorted to determine if they meet the standards in order to be refurbished or sanitized. The inspection, sorting, sanitization of the donations ensures that we are following the CHAP accreditation standards and that the equipment that is going to be sold to the customers is safe to purchase. So we have remained open entirely throughout the COVID-19 pandemic. Goodwill Home Medical Equipment was named an essential business. Throughout the pandemic, individuals continue to require medical equipment, and they also needed to still be able to donate medical equipment. We continue to remain open and follow all of the CDC guidelines. But for some recent news, in September of 2021, Goodwill Home Medical was recognized by the New Jersey Department of Environmental Protection Commissioners as a recycling leader. We received the Source Reduction, Resource Management, and Sustainability Award. This award demonstrates Goodwill Home Medical's outstanding achievement in recycling for source reduction, resource management, and sustainability for the state of New Jersey. In the picture, we have the Vice President, Lynn, as well as the President, Mark Boyd. Okay, so I wanted to throw in a few questions about occupational therapy and the profession. I thought it'd be fun to do a little OT trivia. So for the first question, occupational therapists work with people across the lifespan to engage in their daily occupations that they value. These occupations might include making a meal, taking a shower, getting dressed, taking care of a pet, working, managing medication, and so many more occupations. That's just to name a few. For the first question, one specific occupation that occupational therapists help people with are ADLs. Does anybody know what ADL stands for? You can, if you can say it or from the chat, whatever is easiest.
Yeah, Christina, you can just unmute and say it.
Activities of daily living. I cheated.
Yes,
I'm a therapist, Caleigh. I'm sorry, I cheated.
That's okay. That's okay. Yeah, that is the answer. The answer is ADL does stand for Activities of Daily Living. Activities of Daily Living is one of the 9 occupations defined by the American Occupational Therapy Association. ADLs are daily activities that you perform to take care of yourself. So this might include bathing, showering, personal hygiene, feeding, and dressing. The 8 other occupations defined by the American Occupational Therapy Association are instrumental activities of daily living, health management, rest and sleep, education, work, play, leisure, and social participation. Okay, so moving on, sorry about that, to the second part of the presentation, I'm going to talk about the newly developed relationship and collaboration between Goodwill Home Medical and the University of Sciences in Philadelphia, specifically with the Department of Occupational Therapy. So professional year 2 occupational therapy students come to complete one of their hands-on labs for their assistive technology course at the warehouse. During the lab, the students work to find appropriate medical equipment to meet the needs of clients in different case studies with different needs. By completing their lab at the warehouse, they're able to gain hands-on experience with assistive technology such as power chairs. This type of equipment is not easily accessible, especially for educational purposes. So having this lab at the warehouse is a great opportunity for the students to really get some hands-on experience. This is one example of a case study that the students in the assistive technology lab completed during their lab at the warehouse. I'll give everybody a minute to read over it. So what the students had to do for this assignment was photograph themselves in this chair so that the mid-wheel drive was visible in their photo, then look up how much the power chair cost, the brand, the model number. They also had to determine where the chair needed to be charged and take a picture of this place on the chair. After completing this, they looked up the cost of the current chair. So these case studies allow the students to critically think about their client's needs, explore the equipment, identify the different parts of the equipment, and identify the most appropriate equipment for the client in a case study. Okay, so throughout the fall, the vice president, Lynn, Tighe, and I worked to develop a program. The program that was developed was a marketing plan to increase the members of the community's awareness about the site and the resources the site has to offer. A needs assessment was conducted to determine the main source of referrals and figure out what population would be best to be the target of this program to better increase the awareness of the warehouse for individuals who might benefit from it. And throughout this, it was determined that this plan would focus on mobile physician groups and concierge doctors in South Jersey. Mobile physician groups may be able to provide information to their patients about the site to access medical equipment. Because the equipment can increase their safety, independence, and quality of life at an affordable price. So we met with these mobile physician groups, care coordinators, virtually over Zoom to discuss the site, the warehouse, and then also provided a virtual tour of the warehouse. And then we're able to mail the mobile physician groups brochures and some resources to be given out to the clients that they see. Okay, moving on to the second trivia question. Occupational therapists can only work in hospitals. True or false?
False.
False. Yep, that is, oops. Sorry about that. That is correct. The answer is false. Occupational therapists can work in a variety of settings. Some of these settings include hospitals, outpatient clinics, home health, the school system, the workplace, the community, mental health facilities, group homes, research settings, academia, non-traditional settings, and then there's many more settings as well. Okay, so before I begin discussing my capstone project, I just want to introduce myself a little bit further. I'm a fourth year professional OT student. I will be anticipated to graduate this May. And upon graduation, I plan moving to the Harrisburg area. I have a passion working with the geriatric population. I recently became certified in LSVT BIG, which is an evidence-based treatment program for individuals with Parkinson's disease or other neurological conditions. I hope after passing my boards to obtain a job in a skilled nursing facility or in home health. I began my doctoral experience at Goodwill Home Medical in September. In January, I began completing the experiential portion of my capstone project, and I will be here until April. Over the last few weeks, I began to, and I'm still implementing the project. The project focuses on creating a two-part pilot training program for the non-clinical employees on their essential job functions and the durable medical equipment. Through this training program, self-perceived occupational competence in the workplace is assessed pre and post training through the use of a survey. Occupational competence in the workplace is very important. The way a person perceives their workplace competence might affect how they are motivated to perform their job, engage in the role as an employee, and participate in the occupation of work. Okay, so there is a need for this training program since clinical experience is not required to be employed at Goodwill, and these employees are working with the equipment daily. They need to be able to know how to identify what the equipment is, know the safety features, be aware of some cosmetic features, and understand the use of the equipment. They also need to be aware of what they cannot say to customers since they're not a licensed healthcare professional who can prescribe the medical equipment. Being aware of the things that can't be said, such as making recommendations, fitting people, or performing evaluations for a piece of equipment. This is all important to know when working with this in medical supplies and medical equipment on a daily basis. Okay, so each employee that is in this training receives training one-on-one on their essential job functions and on the DME and some AT as well. The training actually encompasses the components of universal design learning, and there's 3 components to it. It's engagement, representation, and then action and expression. So universal design learning is a framework that is optimized learning for all individuals. The first component is engagement, and that is how to engage all learners. So for this training, the learners are provided with information on their job, on the equipment. The training also addresses the individual's specific needs based on their experience and interest in the equipment. So for example, one of the learners was really interested in learning some more information about the pediatric equipment, and that was incorporated into her training. The second component is representation, and that is how to present information in a way to reach all learners. So additional visual aids are provided to the learner through printed PowerPoints to make notes, mark questions. The training has visual aids incorporated throughout it as well by having pictures of each piece of equipment. All information within the training is at an 8th grade readability level. And visually, there's a contrast between the text and the background within the training content. Learners have the auditory component included through listening to the trainer explain the information. And then they also have kinesthetic input by having the hands-on medical equipment throughout the training. So if we're going over a tilt space or a shower chair, we also have that tilt space right there or the shower chair right in front of them. Then the third component is action and expression, which is a learner being able to show what they know. So the learners are provided with a copy of the PowerPoint to determine at the end of the training what was understood, what might still be in question, and then also to have more time to process and look over the information provided during the training, because some of this equipment is a lot to learn and understand. They also are provided with a time to go through the equipment during the training, ask more questions if they need more hands-on practice. That's all incorporated. The training provides resources to the learner, such as the use of patient education handouts. One resource that is included in the trainings is the different medical terminology, such as the anatomical positioning like flexion and extension, as well as tips to remember these terms. This terminology is important to know and understand in case customers are referring to it when they're purchasing equipment. Examples of some of the DME included in the training is the bathroom and shower equipment. The training also focuses on assistive technology. Some of the assistive technology within the trainings are the wheelchairs cushions, mobility equipment, gait trainers, standers, activity chairs, and tilt and space. This training may allow the employees to better assist the customers and have an effect on their feelings of workplace confidence. So we are having a contest throughout the month of February at the warehouse to name our new mascot, which is the giant Yeti. You can come in during any of our regular business hours to participate in naming our new mascot. Listed on the slide is our warehouse hours and locations. We're open Monday to Friday from 9 a.m. to 3 p.m. and then Saturdays 9 a.m. to 1 p.m. We have an upcoming event that's open to the public. We'll be at the Cherry Hill Mall on Saturday, February 19th from 11 to 3 p.m. We will be at their Vendor Health and Wellness Expo. Before COVID-19, we were lucky enough to have a volunteer physical therapist from Wiseman's Children's Hospital come once a month on a Saturday to assist the customers with the equipment, especially the pediatric equipment. And we're excited to be starting this up again. Wiseman's Children's Hospital will have a table at the warehouse this coming Saturday, the 5th, from 10 a.m. to 1 p.m. So feel free to stop by and come see them. We will also be sending out a February newsletter with upcoming events, as well as recent news and just some educational information. So please feel free to sign up to get that sent to your email. I would like to thank you guys all for taking the time to listen to this presentation and to learn more about Goodwill Home Medical, as well as what has been happening recently. You can find us on social media. We're on Facebook and on Instagram. Thank you all. And does anybody have any questions?
I have a question.
Yeah.
Does Goodwill Home Medical, do you all depend on mostly on the donations of the equipment, or do you ever have equipment drives?
We basically at this point are on donations. We've had equipment drives in the past, but COVID kind of put a stop to that. If you are interested in doing an equipment drive somewhere, please let us know. I can coordinate that. We do it through senior centers. There's a place up in Mercer County that we used to work with. But yeah, I would appreciate that. We can do that, sure.
Have you guys ever thought about reaching out to some of the online durable medical equipment companies that get some of their equipment returned to them for whatever reason and having them donate that, and see if maybe those online stores would be willing to donate that equipment?
We work with a lot of DME companies. We work with manufacturers. Right now, we get donations from Drive Medical. So yeah, all of that comes in. Absolutely. Anybody, we reach out to anybody and everybody. If you know a contact that I could reach out to, I'll be more than happy to do that. That's how we survive. The only thing we do buy is lift chairs. We're a Golden dealer, and we buy scooters from them also. So those are brand new. But thank you. Those were all good questions. Anybody else? Will come in and visit us. I'm sorry, Christine.
Can I ask one more question? Can you talk
Sure.
a little bit more about your recycling? So the equipment that you don't use and that you actually have to recycle, keep that stuff out of the landfill. Can you give us just a few numbers? Because I know that's probably really great numbers that you're keeping out of landfills by recycling it or reusing it. Do you have any numbers like that you could give us?
It is, and I have it in the sustainability report. If you give me a minute, I can pull it up and we can put it on our list so that you can look at that.
Yeah,
I
I
don't-
think that I know it's got to be amazing for you guys to get the award to receive the award you received. I just
Yes.
think it'd be really neat to see the numbers so we can wrap our heads around it. I think that's wonderful what you guys are doing.
Yeah, absolutely. If you want to ask a couple more questions, I can get that for us in a second. Okay, Caleigh, you can talk about.
I have a question. Do you guys have any idea of how many people you're serving? You know, the people that are benefiting from this ballpark?
Yes. We have, I think we have our operations manager online.
Oh,
Ray, would you like to answer that question? I think he's there. I'm trying to find this report. Here we go. So I have a lot of too much information sometimes, right? Okay, so this award was from last year, March 2020. So the numbers are from the 2020 year, which is pretty good because that year everything was kind of closed down. So we picked up a total of over 6,480 pieces of equipment.
gosh.
600,000, I'm sorry, 648,886 pieces of equipment over that year period. Most of it was power chairs, beds. We have a lot of beds, and our top 10 categories for that period. We had over 5,417 customers. The top 10 categories were hospital beds. We were able to divert 20.5 tons, which is approximately 257 beds. 13.8 tons of wheelchairs, which was approximately 920 chairs. 3.8 tons of scooters, which was approximately 90 scooters. But in addition to the scooters, you have the batteries. And every chair usually has about 2 batteries. So there were 315 batteries in that grouping that we were able to divert from landfill. We work with our supplier in batteries and bulbs, and they recycle them. And we also work with another scrapyard. Specialty chairs, we were able to divert 3.7 tons, which is 47 chairs. Transfer aids, 3.8 ton, 89 pieces. Walking aids, 4.10 ton, which is approximately 1,991 pieces. Pediatric equipment, 1.4 tons, which is 83 pieces. And it goes on and on. So if you look at Goodwill in general, Goodwill during that time period, electronic recycling was 843,960 tons, 843,960 tons of recycled electronic equipment. So everybody was purging during the pandemic and the quarantine, and there was no place to put it. So Goodwill got a dispensation from the state to have our donation centers open, and that's where we were collecting. Textiles that were recycled during that period were over 6,000 tons of textiles. Yeah, so we have a lot of a lot of numbers, a lot of things, and a lot of good.
That's fantastic. So the need is there. So thank you guys so much for doing that for the environment.
Absolutely.
It's fantastic. Yeah. Great.
And spread the word. I mean, that's how we survive, is by the donations coming in, obviously. And all of our centers in Central, Southern New Jersey, and Philadelphia collect medical, and it all comes back to our warehouse. and we go through 2 to 3 trailers a week. So I always say it's always Christmas at our back door. So if you need something, let us know. We have a wish list. We'll reach out to you if it comes in. And I see Myra's on here. She knows everything that's in the warehouse. The woman is amazing. And Ray also, Ray's our operations manager. He's on the call, or he's on the Zoom. And they're in the warehouse right now, probably emptying things. But is there any other questions or comments that anybody has? Well, thank you so much. We appreciate you for listening and coming to visit. Please come in and name our Nettie, or Yeti, excuse me, Nettie, Yeti. It's the snowman. But thank you very much.
Thank
And
you.
enjoy your day.